some healthcare providers here in our area are being used as an example of how the president's plan to change the country's health insurance system might work.
Now, those in favor of the bill point to the need for health insurance for everyone and every condition. But others say the plan is just too expensive and could hurt private insurers. Fox 11's Cameron Clark has balanced coverage tonight.
Laura Klitzka of Hobart had a chance of a lifetime a week and a half ago.
To be able to introduce him, not many people get that honor at all. But like I had said, it would have been nicer under different circumstances.
That's because the honor during the president's health care focused visit to Green Bay came during the fight of a lifetime for Klitzka. She's not only battling the cancer she was diagnosed with last year, but also high insurance bills.
It's been difficult. We have a real high premium and deductible plan. It's just real hard with the family.
Stories like Laura's is why Democratic Congressman Steve Kagan says he's in favor of the health care reform draft unveiled in the House of Representatives Friday. The 852 pages calls for affordable health insurance for all Americans with all medical conditions.
It is the most important piece of legislation federally this century. It's about reforming our health care system, which is not just fractured and broken, it simply isn't working and it doesn't add up.
No, I don't believe it is the answer. I don't think it will be sufficient.
The executive vice president of Bellin Health says any effective legislation needs to focus on keeping people healthy instead of just treatment, with things like health risk assessments and incentives to providers for high-quality, low-cost care.
Just looking at providing insurance isn't going to be enough because people don't know how to use the insurance that they have effectively to improve their health. We need to give them the tools to do that.
The chair of the Brown County Republican Party says a government-run or so-called public plan is too expensive, estimated at more than $1 trillion, and fears it could force out private insurers.
People just don't have the choices they do under the present system. So some of the countries that do have public or universal health care, Canada, for instance, is reevaluating that because it's just not working as advertised.
This is just the beginning of the conversation.
Likely making health care one of the main pulses in Washington this summer. Cameron Clark, Fox 11 News.
Now, in addition to the health care reform draft in the House, there are currently 2 drafts of a similar bill in the Senate.